Warm greetings to all our dear uncles, aunts, and viewers who have returned to Holistic Health 24H, the channel that shares natural, safe, and approachable health knowledge, especially dedicated to middle-aged and elderly people. Dear uncles and aunts, after the age of 65, our health is no longer what it was in our younger days. Every meal, every type of drink we consume now should not only satisfy hunger, but also be truly wise choices, because they directly affect our heart, memory, blood pressure, and overall quality of life. There is one type of juice that has been widely praised and shared as a miracle tonic for the elderly: beetroot juice. With its vibrant red color and distinctive taste, this juice is celebrated for its ability to lower blood pressure, improve memory, enhance blood circulation, detoxify the liver, and help seniors walk more easily and energetically. But is beetroot juice really good for people over 65? Who should drink it? Who should avoid it? How much is enough? And how can we take full advantage of its benefits without experiencing side effects? All of those questions will be answered in today's video. We invite you to watch until the end so you don't miss any important information regarding your health and that of your loved ones. 1. Benefits of beetroot juice for seniors. 1. Naturally helps lower blood pressure. At middle and old age, high blood pressure is a common condition that can easily lead to serious complications like stroke, cerebrovascular accidents, or heart failure. The good news is that beetroot contains a very high amount of natural nitrates, a compound that converts into nitric oxide inside the body. Nitric oxide helps dilate blood vessels, reduces resistance in the vessel walls, and therefore lowers the pressure of blood flowing through the circulatory system. Some clinical studies have shown that just a few hours after drinking beetroot juice, people with high blood pressure began to see a slight reduction in their blood pressure readings. A gentle and natural effect, not as sudden as medication. However, this effect is only beneficial when consumed in the correct amount, usually about 100,000 to 150 milliliters per day. Overconsumption is not recommended. What's important is to monitor blood pressure regularly and consult with a doctor if you are already on medication. 2. Improves brain function and memory. In people over 65, blood flow to the brain gradually decreases over time, leading to forgetfulness, difficulty concentrating, and slower reaction times. One underlying cause is that small blood vessels in the brain become hardened and less flexible. Nitric oxide, produced from the nitrates in beetroot, has the effect of dilating cerebral blood vessels, improving blood circulation to the brain, and thereby helping to nourish nerve cells more effectively. A study in the United States showed that elderly individuals who regularly drank beetroot juice had better cognitive function, faster response times, and a lower risk of developing Alzheimer's disease compared to those who didn't consume it. If you've noticed that you've started forgetting small things or feel mentally less sharp, this may be a drink worth adding to your weekly diet. 3. Boosts stamina and energy for light exercise. Many people over the age of 60 often complain, "Just walking a little makes me tired," or "Climbing a few stairs leaves me breathless." This is a sign that the body is beginning to absorb oxygen less efficiently, and circulation is no longer as strong as before. In a study conducted at the University of Exeter, UK, scientists found that beetroot juice can help muscles use oxygen up to 20% more efficiently. This means seniors can walk longer, feel less tired, breathe more steadily, and feel more comfortable after light exercise. If you maintain regular physical activity like Tai Chi, morning walks, or cycling around the house, drinking a small glass of beetroot juice 30 to 60 minutes before activity may help your body move more easily, flexibly, and energetically. 4. Supports liver function and detoxification. The liver is a silent worker that functions daily to filter toxins, metabolize medications, and cleanse the blood. However, as we age, and especially with diets high in oils and processed foods, the liver can become overloaded, leading to conditions such as fatty liver or elevated liver enzymes. Beetroot contains betaine, a natural compound that enhances liver function, supports fat metabolism, and helps eliminate toxins that accumulate in the liver. In addition, the antioxidants in beetroot also help protect liver cells from damage. For elderly individuals, drinking beetroot juice 2 to 3 times per week can help the liver work more efficiently, thereby improving overall health, reducing fatigue, poor appetite, and dull skin, which are common signs of a sluggish liver. If you are looking for a natural, simple drink that offers multiple benefits for blood pressure, brain function, mobility, and liver health, then beetroot juice is truly a worthy option to consider. However, please continue watching the next part to learn clearly. Who might be harmed by this juice? And what precautions should be taken to ensure absolute safety? 2. Risks to be aware of when seniors drink beetroot juice. Although beetroot juice offers many significant health benefits, for seniors, any type of food or drink must be used with caution. Here are the key risks you must pay special attention to before adding this juice to your daily diet. 1. May cause excessive drop in blood pressure. As mentioned earlier, beetroot juice can help lower blood pressure due to its nitrate content. But this benefit is only good if your blood pressure is high. For those who already have low blood pressure or are currently taking antihypertensive medications, drinking beetroot juice too frequently or in large amounts can cause blood pressure to drop to dangerous levels. Low blood pressure may cause symptoms such as sudden dizziness when standing up, blurred vision, loss of balance, unusual fatigue, shortness of breath. In severe cases, falling and hitting the head or fainting. Advice: if you are taking blood pressure medication, consult your doctor before use. Start with a small amount, about 50 to 100 mmol, and monitor your body's response to adjust the intake accordingly. 2. Can cause red urine phenomenon that alarms many people. Some people may notice pink or dark red urine or stools a few hours after drinking beetroot juice. This is known as bituria, a completely harmless reaction caused by betanin, the natural pigment in beets, passing through the digestive system without being broken down. However, because this color closely resembles blood in the urine or stool, many people may panic, thinking they have internal bleeding or urinary tract problems. Advice: if you've just had beetroot juice and notice red urine, remember that this is a normal reaction and will disappear within 1 to 2 days. However, if you've never consumed beetroot and still notice this phenomenon, you should see a doctor immediately to rule out any actual medical condition. 3. Increases risk of kidney stones in people with a history of the condition. Beetroot contains a high level of oxalates, a compound that, when combined with calcium in the body, can form calcium oxalate stones, the most common type of kidney stone in older adults. If you have a history of kidney stones, ureteral stones, or reduced kidney function, drinking beetroot juice frequently may increase the risk of recurrence or worsen the existing condition. In addition, the kidneys in elderly people often function less efficiently, so absorbing too much oxalate can overload the kidneys, leading to dull lower back pain, painful urination, or even blood in the urine. Advice: people with a history of kidney stones should limit beetroot juice intake, or drink it only once or twice per week, and in small amounts. It is best to consult a specialist before using it regularly. 4. Causes digestive issues. If taken at the wrong time or too concentrated. Some seniors may experience the following symptoms when first drinking beetroot juice: bloating or gas, loose stools, mild nausea or acid reflux. This happens because the digestive system of older adults is often sensitive, while beetroot juice has a mildly stimulating effect, especially if consumed on an empty stomach or if the juice is too concentrated. Advice: do not drink it on an empty stomach, especially early in the morning. It's best to dilute with warm water or combine with carrot juice or apple juice to balance the taste and reduce the intensity. If it's your first time trying it, start with just half a small glass, about 50 ml, to let your body gradually adjust. In summary, beetroot juice is a valuable natural drink, but it is not suitable for everyone. For those over 65, using it correctly, for the right person, at the right dose, and at the right time, is the key to gaining the benefits without experiencing unfortunate side effects. In the next section, we will explore how can beetroot juice be used in the most reasonable and safest way for older adults? Please stay tuned. Dear uncles and aunts, beetroot juice can be a wonderful companion for your health in old age, if we understand both its benefits and its risks. When used correctly, at the right dose, and for the right individuals, it can bring great value to your heart, brain, liver, and physical stamina. We hope today's sharing will help you make more informed and wise choices on your journey of natural health care. If you found this video helpful, don't forget to subscribe to Holistic Health 24H and share the video with your friends and loved ones. Wishing you continued good health, clarity of mind, and peace each day. See you again in the next videos. Hoi Chat GPT.